Hey everybody, welcome back. So this video is going to be about everything osteoarthritis in the lower spine or the lower back, its association with pain and chronic low back pain, and the best treatment methods available for this condition. So you should also know that this is the first video of a two-part video series, where my second one is where I'm going to be going through 34 different exercises that's enhancing mobility, strength, improving functional movement, etc. But before you jump there, I highly recommend that you watch this video first, because we're building a more educational foundation on how to manage OA in the low back and how it's more personalized for you. So please watch this video in its entirety before jumping to those exercises. So what exactly is osteoarthritis? We first have to look at what bone remodeling is. So bone remodeling happens constantly regardless of age, where bone tissue breaks down, which is decomposition, and then builds back up, which we call remodeling, into new bone. And the bone density or structure is constantly adapted to the type of stresses you expose your body to. This is why people who complete more weight-bearing activities such as running or muscle strengthening have a higher bone density in their limbs, because their limb bones must adapt to those stresses. Now that we have a better understanding of what bone remodeling is, osteoarthritis basically means that there's an abnormal overgrowth of bone at a joint or where two bones articulate with each other. And this abnormal bone growth is called osteophytes, and these can be confirmed in a radiograph or an x-ray. Now, osteoarthritis starts to become a problem when it starts replacing cartilage tissue, which is our protective tissue in a joint or where two bones glide or articulate with each other. And if there's too much overgrowth, it could start an inflammatory response, as it's taking up too much space within that joint space area. In regards to OA at the spine, there are three structural changes we could look at on a radiograph. The first is vertebral osteophyte formation, vertebral facet joints OA, and intervertebral disc degeneration or disc space narrowing. And common symptoms experienced with this could be pain and stiffness at the lower back, reduced range of motion, tenderness in warm joints, and possible swelling. So now that we know the symptoms of osteoarthritis, how does OA cause pain? So there's a lot of correlative studies showing that OA is most highly associated with increasing age, the female gender because of menopause, heredity, and being overweight. However, we don't know the exact mechanism for why osteophyte formation occurs for some individuals and not others, because some studies have shown that osteophyte formation can still develop when healthy cartilage tissue is still present. And to make matters worse, we also have studies showing that osteoarthritis might be present for some individuals who are asymptomatic, and other individuals who have OA present might have significant pain. So this means that we can't always rely on imaging to say that OA was the cause of your low back pain. Now, building further on this knowledge, it is most likely that osteoarthritis is multifactorial, and I want to go through some proposed theories for why osteoarthritis could develop and progress into pain. So the first theory is the degeneration to the intervertebral disc that can cause abnormal forces to happen throughout the spine with decreasing height. And therefore, this can cause osteophyte formation to happen around the vertebrae and facet joints. So degeneration to the intervertebral disc can be caused by a couple things, which is age, being overweight, and poor posture or spine mechanics during bending activities. Another theory is if there is reduced mobility or strength at a certain vertebral level of the spine, the consequence might be abnormal forces or overuse being at that level. And the same can also be said for overuse at a vertebral level when a certain activity requires us to make repetitive movement for a long duration. And examples for this can be in construction or during a certain sport. Now moving into OA and its association with chronic low back pain, there are some studies showing that if two or more vertebral levels have osteophyte formation, there is a higher risk that that person might develop chronic low back pain. So this might make sense because if we're losing mobility at our lumbar region, this is allowing the development of further osteophyte formation. Now, many people will begin to develop OA regardless in the spine over the age of 50 with maybe no symptoms present. However, the amount of physical activity you get and how you take care and move your spine throughout your life will have a significant impact on how much OA you might develop and if it becomes symptomatic or not. So in the last 5 years, there's been a lot stronger evidence to say that the best treatment method for acute and chronic OA in the low back is going to be specific exercise training and enough daily physical activity. So I wanted to go through exactly what I mean when I say enough daily physical activity, as this is different from specific or prescribed exercise training for OA in the low back, and this can be found in my second video later. Now, we're going to be going through the World Health Organization's website and their standardized recommendations for enough physical activity in adults and adults with chronic diseases. And by the way, their recommendations are based off of decades of research. Okay, so here we're looking at the WHO website for physical activity recommendations, and at the top they have just benefits from doing exercise and enough physical activity. I'm pretty sure everybody is aware of those, but you can look through them if you need to. And then we're going to scroll down to the adults age 18 to 64 years. So their first bullet point is doing at least 150 to 300 minutes of moderate intensity aerobic physical activity, or at least 75 to 150 minutes of vigorous intensity aerobic physical activity, or a mix of that. Now, how I like to describe moderate aerobic activity is where you can fit in sentences here and there, but it's not going to be constant, as you need to work on your breathing, and it's a little bit more uncomfortable if you're going to have full-on conversations. For vigorous activity, this is for activities such as like running or soccer, where you can maybe only say like a word here and there, but it's not going to be a real conversation. So that is for aerobic physical activity. And now if we're going to look at muscle strengthening, they're recommending for this group to do at least 2 or more days a week of muscle strengthening to all your major group muscles at moderate or greater intensity. So they're going to go on to talk about you can increase the amount of physical activity, that's okay. Of course, you don't want the harms to outweigh the benefits, and recognizing that for your own personalized ability. And then we have sedentary activity, and I'll go through a separate article for this later on. So now we're looking at adults 65 plus, and the same recommendations are for aerobic physical activity are actually going to be the same. The only difference is that they're going to add in more multi-component physical activity that's emphasizing more functional balance and strength training, because this group is more at risk for falls or other serious injuries. Now, if we're going to people living with chronic conditions, which is individuals with osteoarthritis, still the aerobic physical activity requirements are going to remain the same, along with 2 days per week of additional muscle strengthening activity, and also with the additional multi-component or functional exercise strengthening, working on your functional capacity in order to prevent adverse events. Again, you can increase the amount of aerobic physical activity if wanted, and that there's a lot of helpful information on this website, so I recommend checking it out on your own. I'll leave the link in the description below if you find this interesting. Now, I know that a lot of individuals coming into physical therapy for the first time who have never exercised, this could be a problem. This is a lot of time that is being recommended. It is the goal of physical activity recommendation. It is not always what we're going to be starting out with. So I developed a little bit of a starter program of what this should look like for somebody who has OA, who wants to start exercising and get enough physical activity. So let's take a look at that. Okay, so in this diagram, I just titled it Beginner Physical Activity and Exercise for People with Osteoarthritis. This is still all evidence-based information. So looking at aerobic physical activity, we're only going to be starting with moderate aerobic physical activity that is about 20 to 30 minutes for workout, 2 to 3 times a week. Then if we're looking at muscle strengthening, trying to pick out 5 to 10 different exercises that are focusing on strengthening the trunk or the legs, 8 to 12 repetitions, 1 to 3 sets, and a frequency also at 2 to 3 times per week. Now, so as we know, that is our physical activity recommendations. Now we're doing like more functional training for osteoarthritis in the lower spine. So the duration for this could be 45 to 60 minutes for workout, And if you're, maybe for the first couple weeks, this could look more like 20 to 30 minutes for workout. And exercises are going to be about 5 to 10. Frequency days per week is 2 to 3 times per week. So again, if the WHO recommendations are a little bit too much to start with, I would start with this program and work up to the World Health Organization's physical activity and specific exercise recommendations. And you can get those specific exercises in the second video coming up. Alright, so we're at the end of the video, and I hope this was helpful and informative for you on osteoarthritis of the lower back. But please, if you have further questions or comments, please go ahead and leave those below, as that's the easiest place for me to get back to you. And if you still want further help, I do offer free 20-minute Zoom sessions where we're going over your medical history and making sure you're taking the right steps towards healing. You can also find the links for that below in the description. And as always, I hope you have a wonderful rest of your day and you're taking care of your low back. Take care.